Good afternoon, guys. I'm Dr. G, and I've been doing aesthetics for 7 years now. I wanted to talk about Botox today. Botox has been around for 20, 30, 40 years now. It started out actually around the 1980s when they were using it for blepharospasm. So when people had eyelid spasms, they would inject botulinum toxin, and it would help relax those muscle twitching. Then they noticed that the crow's feet disappeared and people looked younger. They started using it for cosmetic purposes. Typically, the three areas where people use it the most are the frown lines, it's called aka glabella, the forehead lines, and the crow's feet. So those are the three most common areas. It can also be used for bunny lines. You can also use it for the DAO, which causes the downturned smile, masseter injections for TMJ pain or for grinding or slimming the face. Also can be used for in the neck for the platysmal bands and for hyperhidrosis for excessive underarm sweating. It can be used in other areas as well for bladder spasms and for wound healing. Actually, they're using it for just before surgery so that there's less tension on the incision. Botox has been time tested. It's super safe. Usually it kicks in about 7 to 10 days, but there are newer formulations now that do kick in 1 to 2 even days, so it's a lot quicker. So other than that, it usually lasts for 3.5 to 4 months. The typical side effects, people may feel like a headache. That's 1% of the population. Afterwards, usually it's for people that have had their forehead injected for their first time. They can feel a little bit of a discomfort in their head. Other than that, bruising and bleeding are usually very minimal risk. Usually I have people ice beforehand just to kind of numb up the skin a little bit so that the needle poking the skin is less painful. Botox has been around for quite a while now. There are actually currently 6 different medications that are FDA approved in the US. So there's Botox, Sport, Xeomin, Jeuveau, Daxxify, and the latest one is called Letybo. So that's the one that's right here. I just got this last week. I've been using it on my patients. I do like the results. So this is the Xeomin that I typically have been using a lot of. It's great because it's very similar to Botox. The molecular structure is actually a lot smaller. So it's a lot more pure form of the botulinum toxin. So if you see, like, this is the botulinum toxin molecule. This is all preservative protein. Blue, which is 150 kilodalton, is actually the part that's left. This is the active ingredient in Botox. You know, for people that are looking for a pure form of Botox, Xeomin is perfect. So the Daxxify is nice because it does kick in a lot quicker. Usually in 1 or 2 days, people start noticing an improvement, and it lasts for up to 6 months, sometimes up to 9 months for some patients in their clinical studies. Then the Letybo is the newest one from South Korea, and that kicks in 1 to 3 days and lasts for 4 months. So, you know, we can slight differences in the way that they spread once you inject it into the tissue. So, you know, different ways to play around with what muscles you're targeting. And so the Daxxify and Letybo tend to be pretty precise. Their spread is about a dime size, whereas Xeomin is about a nickel. And then this port tends to be a little bit more and about a quarter size. So I really do like the way that it works in the forehead. I usually do microdosing in the forehead, and I do like for the crow's feet and the frown area as well. You know, we can always with how your muscles look and how they move to make sure that we're targeting the specific areas that you know, to attain your goals. So this is a little bit of a review of botulinum toxins, or what's known as neuromodulators. They're basically medications that work at the neuromuscular junction, so it prevents the muscle from contracting because it blocks the acetylcholine release. And over time, your body will regenerate those receptors in the neuromuscular junction, and the muscle will start contracting again. So it's you know, time tested, super safe. Make sure that you are going to experienced injectors, and they're using quality products, and that they follow up with you to make sure that you are having the best experience, and that, you know, safety is always number one. So, you know, but we all want to age gracefully, and we want to look good and look our best. So I want people to feel their best and live their best life. So thank you for watching. If you have any questions, please reach out. This is just like some information about Botox, and you know, if there's anything I can provide for you, just let me know. If you have any questions, just reach out.